Good morning. This is the last week and this is the last unit, hospital statistics. So first we will see a small introduction for the concepts hospital statistics. Hospitals collect data about both inpatient and outpatient on a daily basis. Usually to run a hospital in more effective way, we need to collect data from the patients and even sometimes from the employee also. So the statistics is approached in hospital, that is what hospital statistics. And hospital, they use these statistics to monitor the volume of patients treated daily, weekly, monthly, or within some other specific time frame. These statistics give healthcare decision makers the information they need to plan facilities and to monitor inpatient and outpatient revenue streams. For these reasons, health information management professionals must be well versed in data collection and reporting methods, because most of data collection and reportings are now automated. It is important to understand the underlying concepts from which these data are generated. Now, the definition for hospital statistics. Information obtained from hospital, indoor and outdoor facilities regarding quality of care, utilization of services, quantity of services delivered, workload, and other hospital-related administrative and logistic affairs is called hospital statistics. Uses of hospital statistics. Measures of evaluation of quality of care, helps in planning, allocation of resources in different areas, identify deficiencies of various levels, input process and outcome of service, then evaluate effectiveness and efficiency of the administration. These are the uses of hospital statistics. Next, types of hospital statistics. Reports related to hospital beds. In that first type, reports related to hospital beds, we discuss daily census, daily average attendance, bed occupancy rate, bed turnover rate, then bed turnover rate interval, uh, total patient days care, vacancy rate, hospital beds, sanctioned beds, functional beds, bed supply rate. All this we need to discuss in reports related to hospital beds. Second, reports related to admission, discharge, or death. First, admission. We need to see daily admission, total admission over a period. Next, discharge. In discharge, we need to see daily discharge, total discharge over a period, then average length of stay also we need to check. In deaths, daily number of deaths, total deaths over a period, total deaths over 48 hours, total deaths under 48 hours, net death rate, gross death rate, post-operative death rate, anesthetic death rate. All this we need to focus. Third, workload statistics, that is total number of outputs, new cases or repeat cases, total number of operations, total number of x-rays, average OPD patients per day, total cesarean sections per day, average number of food service served per day. All this we discuss with workload statistic. Then hospital care evaluation statistic, HEI rate, post operative complication rate, autopsy rate, percentage of agreement between final and pathological diagnosis, gross result of treatment, and patients recovered, improved, or not relieved. All this we discuss under hospital care evaluation statistic. Then indices related to population at risk. Here we collect information like admission rate, hospitalization rate per person, bed population index. All this we discuss. Now, collection of data the hospital should track. First, daily basis. Quality measures such as infection rates, patient falls, and overall mortality. Patient census statistics, discharged not final bill claims. All this we need to collect that means the hospital should track in daily basis. And the hospital should track monthly basis point of service cash collection, percentage of charity care, percentage of budget spent for each department, door to discharge times, patient satisfaction scores. All this information month-wise hospital should track. Then colleague satisfaction scores, market share and service line development. This annually hospital should track. Inpatient bed occupancy rate. That means another indicator of the hospital financial position is the inpatient bed occupancy rate, also called percentage of occupancy. The inpatient bed occupancy rate is the percentage of official beds occupied by the hospital inpatients for a given period of time. In general, the greater the occupancy rate, the greater the revenue for the hospital. For the bed included in the official count, so the greater the revenue for the hospital for a bed to be included in the official count, it must be set up, staffed, equipped, and available for patient care. Average daily census or average daily bed occupancy. This can be calculated by total number of patient days for a period, that is except newborn, out of total number of days in the same period. By using this formula, we can calculate average daily census. Then average length of stay of discharged patient. For finding this, we can use this formula, total length of stay of discharged patients for a given period divided by total number of discharges and deaths in the same period. Next, percentage of occupancy of inpatient beds. To calculate this, we use total number of patient days for a given period is multiplied by 100 divided by available bed, that means bed complement, multiplied by the number of days in the period. Next, bed turnover interval. That means average period in days that an average available bed remains empty between the discharge of one patient, inpatient and the admission of the next. It indicates the time that available beds are free. It indicates a shortage of beds when negative and under use of the hospital or an inefficient admission system of if positive. Next, bed turnover rate, the mean number of patients passing through each bed during a period, and it indicates the use made of available beds. Number of discharges separations in the period divided by available beds, that can be used to calculate bed turnover rate. Here I have given some examples how to calculate the bed turnover rate. Then average bed occupancy rate, average number of days during which the bed is occupied by a patient in the course of a given period of time. Then average daily census, average number of patients in the hospital at a given time period per day. This is the ratio of the total number of inpatient days to the total number of days in the same period. One example also given for this. So this is what we discuss with the hospital statistics. Thank you.